Yeah, a very good morning to all the third year pharmacy students. So this is Dr. Sunil Kumar. So let's continue our discussion on chemotherapy. So I think I was discussing about adverse effects of penicillin. In adverse effects of penicillin, we discussed that penicillin is very safer drug. It can be given around 60 grams per day. So penicillin G can be injected in a dose of 60 gram per day without any direct toxicity. Okay, and we also discussed two adverse effects mainly. One is local irritancy and direct toxicity. And next, we have also discussed about hypersensitivity and anaphylaxis. Anaphylaxis is very dangerous one, but it is rare. Okay, so out of 10,000 individuals, there may be a chance of 1 to 4 individuals having this anaphylaxis, may get anaphylaxis. Okay, so that's why it is very rare. So third one, let's continue our discussion. The third adverse effects with penicillin, it is super infection, okay, which is also less serious. So let me just share a screen. Yeah, I think this screen is visible to everyone. Yeah, just yeah, you please just note down super infections. Okay, I think this I have discussed several times. Super infections, super infection is nothing but development of a new infection during chemotherapy of a primary infection. Okay, or in simple language, I can say that when you use a broad spectrum antibiotic, it will kill the dangerous one or harmful bacteria. Along with that, it will also kill the friendly bacteria, the friendly intestinal flora that is protecting us from several diseases, which is a part of our immune system, immune mechanism. That friendly bacteria will also be destroyed by broad spectrum antibiotics. Okay, so that will result in the formation of several infections, okay, including antifungal, diarrheal, sorry, including fungal infections, including amoebiasis, helminthiasis, okay, so viral infections, etc. That is what we call it as super infection. So technically speaking, we can define even in this manner: destruction of destruction of normal non-pathogenic friendly bacteria by a broad spectrum antibiotic and giving space for the development of new infection. Okay, so that is what we call it as super infection. Okay, so a broad spectrum antibiotic will kill the harmful bacteria, but it may also kill the friendly bacteria which is present in your GIT, and it may open the doors for new infections. So that is what we call it as super infection. But it is rare with penicillin G because I uttered a word that is broad spectrum. So, but here penicillin G is not a broad spectrum antibiotic. Penicillin G is a narrow spectrum antibiotic. That's why, so chances of super infection is very rare because of its narrow spectra. Okay, you can see here refers to the development of new infection that occurs during chemotherapy of a primary infection. Okay, and it is rare with penicillin G because of its narrow spectrum. So as the penicillin G is having a narrow spectrum, the chances of super infection is very less. Okay, so that is the third one, super infection. Now coming to the fourth, one of the peculiar and most important reaction that is seen with penicillin G is Irish, J silent, Irish Herxheimer reaction. Irish Herxheimer reaction. So this is a typical reaction that occurs when penicillin injections are given in syphilis patient. Okay, you know what is syphilis? Syphilis is a venereal disease, that is sexually transmitted disease. It is caused by a bacteria that is called spirochete. Okay, so it is caused by a bacteria that is what we call it as spirochete, that is coiled bacteria. So this is what we call it as spirochete, and the name of the bacteria is Treponema. Treponema. This spirochete is Treponema pallidum. Treponema pallidum. Treponema pallidum. Okay, fine. So penicillin is used to kill Treponema pallidum, which causes syphilis. And syphilis, you know that it is a sexually transmitted disease where there is a wounds or lesions on the sexual organs. Okay, so especially in males. So where there is a lesions or wounds or ulcers on the sexual organs. Okay, so that is what we call it as Treponema pallidum infection, which is transmitted through sexual contact. And here, when syphilis is given, when penicillin is given, penicillin will kill this Treponema pallidum, and as a result of that, the bacteria will die. Syphilis will be cured. That's fine. But when this bacteria will die, it releases a large amount of toxin. It releases a large amount of toxin. Suddenly it releases. Okay, and that is called as lytic products. You can see here. Okay, I have clearly mentioned lytic products. Okay, so it releases lytic products. And when that bacteria releases lytic product in large quantities in the body, as the bacteria die during this penicillin treatment, that will result in the following symptoms. Okay, what are the symptoms? Produces shivering, fever, myalgia. Okay, so shivering means there is a severe involuntary jerky movements. Okay, there is a severe involuntary jerky movements, like how we shiver in malaria, in cold. So same kind of shivering can be seen. Fever will be high, muscle pain will be there, that is myalgia, and even vascular collapse. So BP will fall down. There is a low BP, and as a result of low BP, the person will collapse. Okay, these are all the symptoms that is seen in Irish-Herxheimer reaction. I will repeat. Irish-Herxheimer reaction, you can just observe here what I have written. So it might not be clearly visible, but I would like to read it out. So Irish-Herxheimer reaction occurs when large quantities of toxins are released in the body. As bacteria die during antibiotic treatment. Okay, when syphilis is treated with penicillin, the syphilis causing spirochete or spherical bacteria, coiled bacteria, so that is Treponema pallidum. So when it is when the Treponema pallidum, which is responsible for syphilis, when it is killed with penicillin, so when the bacteria die, when Treponema pallidum die, it releases a large amount of toxins, and as a result of those toxins, for around 12 to 22, 72 hours, here you can see, for a period of 12 to 72 hours, there are certain symptoms which include shivering, fever, myalgia, and even vascular collapse, and even there is severe rashes on the skin. That there is a picture that I would like to show. There is a severe rashes on the skin, and this is due to, here you can see, and this is due to sudden release of spirochete lytic products. Spirochete lytic products. Okay, it's a natural reaction of our body to this toxin. Okay, so that's why if you want to avoid it, just you can give an antipyretic or any non-steroidal anti-inflammatory drug, so that these symptoms, fever, myalgia, and pains can be minimized. Okay, so I will repeat. Irish-Herxheimer reaction occurs when large quantities of toxins are released in the body as bacteria die during antibiotic treatment. Okay, penicillin injected in a syphilis patient, it will kill Treponema pallidum, which is responsible for syphilis, which is a spirochete coiled bacteria as is shown. And when this bacteria will die, it releases a large amount of toxins, okay, which we call it as lytic products. And for a period of 12 to 72 hours, the patient may have symptoms like shivering, fever, myalgia, and vascular collapse. And this particular side effect or adverse reaction, it is called as Irish-Herxheimer reaction. Okay, so let me show you a picture. Just a minute. Just a minute. I have a picture of this syphilis. Just a minute. Here it is. Yeah, I hope this is visible to everyone. So this is what happens in Irish-Herxheimer reaction. So you can see large amount of rashes, redness on the skin. Okay, along with fever, pain, myalgia. Okay, is it clear? Shivering, fever, myalgia, vascular collapse. Even you can see this kind of rashes are going to develop in Irish-Herxheimer reaction. Okay, so that's it. So that is about Irish-Herxheimer reaction. Please remember this because it is one of the specific side effects that might be asked in examination. Okay, so I will go back to the original slide which we were discussing. Yeah. So just a minute. Yeah, that completes. Just a minute. Just a minute. Okay, so that completes the adverse effects of penicillin. Now let's discuss the uses of penicillin. Okay, what are the uses of penicillin? Let me have a discussion. Okay, here I have mentioned the uses of penicillin. Okay, you can just observe. First one is just a minute. Yeah. So first one you can see it is used in streptococcal infections. Okay, and especially here in streptococcal infection or inflammation to the pharynx, that is pharyngitis, inflammation to the ear, otitis media, scarlet fever, and rheumatic fever. Okay, so scarlet fever. Scarlet means a reddish rash. It is also caused by one of the streptococcal bacteria, and where you can see red color rashes on the skin. Okay, that is scarlet fever. Along with fever, along with I mean to say that other hypersensitivity reactions. So this scarlet fever, the major symptom is you will have a reddish color rash. Okay, so let me just show you a picture of this scarlet fever. A patient suffering from scarlet fever. I think I have with me. Yeah, it is there. Yeah, see, you can see. Just a minute. I think this is not visible. Yeah. So are you observing this portion especially? Yeah. So this is what we call it as a red colored rash. This is one of the significant symptom of scarlet fever. Okay. And in scarlet fever, which is caused by streptococcal bacteria, okay, so which is a gram-positive bacteria, and for that penicillin is found to be very, very effective. And one of the symptom of scarlet fever is rashes. This kind of red colored rash will be developed on the chin especially. Okay, yeah, so that is one thing. Yeah. And rheumatic fever. Rheumatic fever is a streptococcal infection that is mainly going to affect especially joints as well as heart. Okay, and one of the significant symptom of this rheumatic fever is that it affects joints and especially cardiovascular system, and that is very dangerous. Okay, and that will also result in leakage of joints. Okay, there is an excessive watery discharge from the joints. Okay, and also there is a severe inflammation of the heart. Okay, so that is what we call it as rheumatic. Okay, the word rheum, that is rheumatic. Okay, rheum means watery discharge. There is a watery discharge from the joints as well as the layers that is lining the joints and heart. Okay, so that is also a dangerous infection. Okay, which can cause severe damage to the heart as well as joints. Okay. And another infection where penicillin plays a very, very useful role, let me point it out, that is called SABA, that is subacute bacterial endocarditis. That is subacute bacterial endocarditis. Okay. In this infection, subacute bacterial endocarditis, there is an inflammation of innermost layer of the heart. Okay, you know that pericardium is outermost layer, then comes myocardium, then comes endocardium. Endocardium is the layer which is going to line the innermost layer of the heart, and also valves. Valves of the heart will be lined by endocardium, and also blood vessels. Blood vessels, the innermost layer of the blood vessel is your endocardium. So that's why there is a severe inflammation to the endocardium layer, and that is what we call it as subacute bacterial endocarditis. Subacute bacterial endocarditis. Okay, so there you can use this penicillin G. Okay, and along with that, just a minute. Sorry, there was a problem. Just a minute. Okay. Along with subacute bacterial endocarditis, which is nothing but inflammation of endocardium layer of the heart. Endocardium is the innermost layer, which is going to line the walls of the heart, which is going to line the valves, tricuspid, bicuspid valves, and which is also going to line the innermost, which acts as an innermost layer of the blood vessel. Okay, so severe inflammation of this endocardium layer of the heart and blood vessel, that is what we call it as subacute bacterial endocarditis. So next comes pneumococcal infections. Okay, so pneumococcal. Okay, so here in pneumococcal, which is also a gram-positive organism. So in pneumococcal, two things. One is pneumonia, which is inflammation of the lungs, and meningitis, which is going to cause damage to where there is a severe inflammation of the layers of the brain, that is arachnoid space, white matter, dura matter, pia matter, gray matter. So all these meninges, which will form the layers of the brain, they will be inflamed, they will be severely damaged or swollen. Okay, so that is what the problem. And these meninges are present at the base of the brain, we know that. So inflammation of the meninges will lead to meningitis, and inflammation of the lungs will lead to pneumonia. And in both pneumonia and meningitis, pneumococcal bacteria plays a very important role. That's why, so here for this pneumococcal infections, penicillin is very, very beneficial. Okay, and here you can see staphylococcal infections. It is also very, very effective in staphylococcal infections. Okay, which is going to cause your strep throat. Okay, so which is going to have severe damage to your throat as well as severe damage to your digestive system. Okay, and even in gonorrhea, which is also a STD, sexually transmitted disease. So Neisseria gonorrhea, here you can see Neisseria gonorrhea causes this gonorrhea, and in males it causes urethritis, inflammation of the urethra. So urethra is a canal, membranous canal, through which urine is discharged from the blood. Okay, you know that. So from bladder, urine in males, urine will enter into urethra. From urethra, it is discharged out. Okay. And inflammation of the canal from which urine is discharged, that is called as urethra. Okay. And there is a severe inflammation of urethra in gonorrhea, that is called urethritis. Okay. It is also a STD. It is transmitted through sexual contact. Okay. And also, as I told you, syphilis. There is a wound or ulcer to the genital organs, okay, which is caused by Treponema pallidum, and penicillin is very effective in syphilis, but it causes a temporary reaction for 12 to 72 hours because the penicillin, when it kills syphilis bacteria, Treponema pallidum, that bacteria will release a large amount of toxins, and that toxins will leads to symptoms like shivering, fever, myalgia, and even low BP or vascular collapse. Okay, so that is that's why you can use penicillin during syphilis infection. And diphtheria, you know that diphtheria, it is caused by a gram positive bacteria, that is Corynebacterium diphtheriae, where there is a severe swelling of nose, okay, throat, and even larynx. Okay, and you can see we call it as bull's eye. Sorry, I mean to say the bull's neck, where there is an adjoint layer, where there is, you know, when you know, in case of bull, so we can see that there is an adjoint layer that is suspending in the throat of a bull. Okay, have you ever seen the throat of a bull? So you can see that there is a suspending layer. Okay, so in the same manner, you will have an adherent layer that is present, especially at the bull, at the throat. Okay, so that is one of the problem with the diphtheria, Corynebacterium diphtheria, and this is also one of the dangerous bacteria which will die, and when it die, it releases a toxin, and that toxin will cause serious internal damage, which can even causes internal damage. Okay, so one of the major symptom is bull's neck, an adherent layer or a pseudo membrane. We can use the word pseudo membrane. Normally, we don't have any adherent layer here in the throat, but in here diphtheria, there is an adherent layer that is attached in the throat, just like how you can see an a layer that is suspending in the bull's neck. Okay, is it clear? So that is what we call it as diphtheria. In diphtheria, you can use for you can use penicillin. Okay, and lastly, tetanus, tetanus, tetanus and gas gangrene. So tetanus is a very, very dangerous infectious disease. It is produced by a bacteria that is called Clostridium tetani. Clostridium tetani, and you know that one of the symptoms of this tetanus infection is severe spasm of your muscles. There is a severe contraction of your skeletal muscles followed by convulsions. Okay, and the muscles will be severely contracted in such a way that your entire body will become very, very, very rigid, and in serious cases, your entire body will be bent like an arch. Your body will be bent like an arch. Okay, that's why we call it as arching. We use the word arching, ARCHING, arching. Your body will be bent completely like an arch. Like this, your body will be bent like an arch. Okay, and I think this tetanus, it is going to spread through wounds. That's why whenever you have a wound, whenever your skin will be punctured, whenever you step over a thorn, or whenever your skin is punctured by some rusted iron, or some iron sharp iron objects, immediately you should have tetanus, because this infection is very dangerous. It can it can cause death, it can take life if it is not treated promptly. That's why in order to avoid this infection, so you can use TT, tetanus toxide, okay, which will be given generally whenever you are going to have a cut or injury. especially when your skin comes in contact with some sharp iron objects. Okay, or whenever your foot unknowingly you keep your foot on a thorn. So definitely, so your parents or I mean to say that generally it is suggested to have a TT injection. Okay, or in order to avoid the symptoms, if the infection occurs, you can go for penicillin. Okay, because penicillin is very effective against Clostridium tetani. Okay, yeah. And coming to gas gangrene. Gas gangrene is also an infection which is caused by Clostridium perfringens. Clostridium perfringens, Clostridium perfringens, where there is a deposition of gas inside the body. Okay, where you can see here, where the the muscles and subcutaneous tissues become filled with gas. Okay, where the bacteria will release a toxin, and that toxin contains large amount of gas. Okay, it is a mixture of carbon dioxide, hydrogen, nitrogen, and oxygen. So it is the gas contains a mixture of these compounds: carbon dioxide, hydrogen, nitrogen, and oxygen, and that will be filled in subcutaneous tissue, muscle and subcutaneous tissue. And this gas gangrene is caused by a particular bacteria that is called Clostridium perfringens. Perfringens. Okay, so it is a dangerous condition. I think I have a pic of this gas gangrene. Let me just share the screen. Yeah, let me show you both. First, you see, just a minute. Yeah, you can see this is tetanus. This is the problem with tetanus. Okay, so you can see the body is completely arched. You can see the entire body is bent like an arch. Okay, so this is Sir Charles Bell's portrait of a soldier dying of tetanus. The characteristic rigidity of the body is referred to as opisthotonus and rhizus saurodinnicus. Okay, originally in the Royal College of Surgeons in Edinburgh, Scotland. Okay, so this is called as opisthotonus, or you can also call it as arching, just arching. So body is bent like an arch. So this is one of the symptom of your tetanus. Okay, and let me also show you this gangrene, gas gangrene, how it appears. Just a minute, I have another pic. Let me show it. Yeah, here it is. Yeah, you can see. Sorry. Yeah, I hope now it is visible. Let me slightly zoom it so that it should be visible to everyone. You can see. So this is what we call it as gas gangrene. Okay, and if the condition is left untreated, definitely this entire gas gangrene, okay, this is the pus or gas-filled cavity on the thigh. Okay, and if the condition is left, definitely it will cause dead and decay of entire thigh region. Once again, finally the option left is to amputate. You have to have a surgery and you have to remove the thigh. Okay, such a dangerous condition, and this is caused by Clostridium perfringens. Okay, and this Clostridium perfringens bacteria, it releases toxins which is filled in these cavities, which releases toxins, and those toxins will produce gas, which is a combination of oxygen, carbon dioxide, nitrogen, and hydrogen. Okay, and this is a dangerous condition, and one of the wonderful drug which is effective on Clostridium perfringens, that is your penicillin. Okay, yeah. Yeah, let me come back to our original slide. Yeah, here. Okay, understood. So that is about 8.1, tetanus and gas gangrene. Yeah. Yeah, next, lastly, penicillin is also used in the prophylactic treatment of rheumatic fever. Rheumatic fever. So as I told you, rheumatic fever is nothing but it is fever that occurs due to watery discharge from the connective tissue marked by inflammation and degeneration. I think just few minutes before I mentioned. It is a fever that occurs due to watery discharge from the joints, especially connective tissue. Joints followed by marked inflammation and degeneration. There is a characteristic destruction of the joint, and followed by the joint. There is a watery discharge from the joint. Okay, there is a watery discharge from the joint, and there is a characteristic damage to the joint. Okay, that is inflammation to the joint followed by watery discharge, and that one of the symptom is high fever. One of the symptom is high fever. Okay, in that condition, even in rheumatic fever, that is also a streptococcal infection. That is also a streptococcal infection. Please remember, rheumatic fever is an streptococcal infection. So in rheumatic fever, so where your joint and even sometimes heart will be affected by the streptococcal infection. So that's why, so fever is one of the major symptoms. So that's why you can prevent this rheumatic fever with continuous treatment with penicillin. Okay, that's it. So that is about the various uses of penicillin G. Okay, so now coming to semi-synthetic penicillin. Okay, so why you require semi-synthetic penicillin? What are semi-synthetic penicillin? See, semi-synthetic penicillin are produced by chemically combining specific side chain. I told you, penicillin consists of two fused rings. One is a beta-lactam and thiazolidine ring. To thiazolidine ring, you have an R linkage. R linkage, which is attached to the beta-lactam ring. Okay, to beta-lactam ring, you have an R linkage. And that R linkage will be connected to the beta-lactam ring through an amide group. Okay, and to that R linkage, you can just change if that to that R position on the amide group. If you are going to add benzyl, then it becomes penicillin G. Okay, but if you remove benzyl group and if you add various other molecules, then it becomes semi-synthetic penicillins. Then it becomes semi-synthetic penicillin. Then various semi-synthetic penicillins can be produced if you remove the benzyl group of penicillin G, and if you chemically combine various side chains. Okay, then it becomes semi-synthetic penicillin. Because you know that the difference between synthetic and semi-synthetic. Synthetic means purely obtained from natural. Natural means purely obtained from natural source. Okay, penicillin G is natural because it is obtained from Penicillium chrysogenum. Okay, it is in pure form. Synthetic means like drugs like cotrimoxazole, drugs like sulfonamides, which are purely obtained in the laboratory. But this is semi-synthetic. Semi-synthetic means you are obtaining an antibiotic from natural source, and you synthetically you are going to modify it. Okay, in the laboratory you are going to slightly modify the antibiotic in order to get desirable properties. So that becomes semi-synthetic. Okay, is it clear? So now here I also mentioned procaine penicillin and benzathine penicillin are salts of penicillin G. Please don't confuse. Procaine penicillin G and benzathine penicillin, they are long duration of action penicillin. They are salts of penicillin. They are not semi-synthetic penicillin. You are not going to change the structure of penicillin in procaine and benzathine penicillin. You are going to convert that penicillin into a particular salt by adding certain local anesthetic, and that particular procaine penicillin or benzathine penicillin, it will release the penicillin G very, very slowly, so that the duration of action of penicillin can be enhanced, and there is no requirement of multiple injections. That multiple injections can be avoided. Got it? So procaine penicillin G and benzathine penicillin are salts of penicillin G. They are not semi-synthetic penicillin. Okay. So before classifying penicillin, the semi-synthetic penicillin, let's have a discussion of the disadvantages of penicillin. Okay, what are the disadvantages of penicillin G? That has to be addressed. So here, penicillin G is having following disadvantages. What are the following disadvantages of penicillin G that led to the synthesis of semi-synthetic penicillin? Okay, so what are the disadvantages of penicillin G that led to the... Yeah, just a minute, sorry, there was a disturbance. Yeah. So what are the disadvantages of penicillin G that led to the synthesis of semi-synthetic penicillin that I would like to discuss? You can see here. So penicillin G has following disadvantages. What are those disadvantages? First, it is inactivated by gastric acid. You can't take it orally because only 1/3 is will be available for absorption. Rest of the penicillin G will be inactivated by gastric acid. That is first disadvantage. And another disadvantage is it is rapidly excreted. Okay, its duration of action is very short. It works only for 2 to 2.5 hours because it's rapid excretion by tubular secretion. Okay, that's why third one is it has shorter duration of action. Okay, and fourth point, as I mentioned, it is inactivated by some enzymes which develops resistance. One of the enzyme, one of the bacteria, one of the enzyme that is produced by many bacteria, including Staphylococcus. Okay, so Staphylococcus aureus bacteria. So that immediately gains resistance to penicillin by producing an enzyme. That enzymes will immediately inactivate the beta lactam ring. Immediately it will break the beta lactam ring. That is penicillinase. You can see here I have mentioned penicillinase. So penicillinase is an enzyme that is produced by many resistant bacteria which will directly cleave or break down the beta lactam ring of the penicillin and it inactivates penicillin. That's why in any bacteria, if penicillinase is produced, that bacteria will not be killed by penicillin. So that is one of the disadvantage. Okay, and it has poor brain penetration. This is also one of the problem. Its penetration to the brain is very poor. I told you its penetration to the brain is poor. Its penetration to the serous cavities is also poor. But however, in presence of inflammation, so definitely sufficient quantities of penicillin G will enter into the brain and that will provide enough therapeutic effect. Okay, so that's why as its distribution to the brain is poor, it is only used in meningitis. But rest of the other cerebral infections, penicillin is least preferred. Okay, that is one of the disadvantages. And major disadvantage is antibacterial spectrum is very narrow. You can see here, antibacterial spectrum is very narrow. It is effective only on gram positive, only on gram positive. Okay, and mostly on gram positive, only few gram negative, like I mentioned, Neisseria meningitis, and some one or two other gram negative bacteria. Okay, so Neisseria meningitis and some bacteroides fragilis. Okay, or some Proteus bacteria. Only some 1 or 2 gram negative bacteria it is effective. Okay, so let me show you just a minute. Let me have you can see here. So Neisseria gonorrhea, Neisseria meningitis. You can see these two gram negative bacteria. Okay, so these two Neisseria gonorrhea, Neisseria meningitis. On these 2 gram negative bacteria, it is highly effective. But even Staphylococcus aureus, you can see earlier it was sensitive, but now it started producing penicillinase. That's why it has gained resistance. Okay, so that's why one of the major problem is it is effective only on gram positive. Only that Neisseria meningitis and Neisseria gonorrhea they are sensitive to penicillin. Only few gram negative bacteria are sensitive to penicillin G. And hypersensitivity is one of the common problem which will lead to allergic reactions, and it is also inactivated by another enzyme that is called beta lactamase. Penicillin will be killed by many penicillin will be inactivated by many resistant bacteria by producing an enzyme that will directly damage the beta lactam ring. So that is called beta lactamase. Beta lactamase, and even penicillinase is a type of beta lactamase. Please try to understand. Penicillinase is one of the type of beta lactamase. Okay, so that is the problem. That is the problem with penicillin G. Okay, so penicillin G has the following disadvantages. Let me once again just have a revision. It is inactivated by gastric acid. It is rapidly excreted. It has short duration of action. It is inactivated by penicillinase enzyme, so that most bacteria which synthesizes penicillinase, they will gain quick resistance to penicillin, and its distribution to the brain is poor. Its antibacterial spectrum is very narrow. It is effective only on gram positive organisms and few gram negative organisms like Neisseria meningitis and Neisseria gonorrhea or some Clostridium species. and it is one of the major problem with penicillin is hypersensitivity. Allergic reactions are common, and it is also inactivated by beta lactamase, which will cleave or hydrolyze the beta lactam ring of penicillin and inactivate. So many resistance bacteria which are going to produce beta lactamase, they will not be killed by penicillin. Okay, so that's it. That is about the semi-synthetic penicillin. Okay, so I will stop now. We will continue our discussion in the next coming class. So please go through this video and please try to follow. And if you have any doubts in the middle of the video or at the end, please let me know. Okay, because as many doubts you ask, so I will try to provide you that much of clarified information. Okay, is it clear? Yeah. Thank you. Thank you. Thank you very much.